When was the last time that you collaborated with another professional and learned something that has had a big impact on your role as an occupational therapy provider? Connie Hunt, a speech and language pathologist, comes on the show today to discuss the importance of collaboration and the impact it has on learning and improving our clinical roles. From collaboration between therapists and other healthcare professionals, or students and supervisors, or even clients and their families, Connie is a firm believer that building positive foundations through collaboration can help therapists make the largest difference in the lives of their clients, colleagues, and students. And make sure you listen to the end of the episode for details about a special giveaway of Connie's children's book series. If you're interested in occupational therapy, this is the place for you. This show aims to explore our profession by sharing who we are and what we do. Because for us, occupational therapy is more than just a job. Hi, I'm Sarah. Welcome to OT for Life. Hi, Connie. Welcome to the show today.
Hello, Sarah. I'm so excited to be here.
I'm excited to have you here. And I'm really, really excited because you are actually the first speech language pathologist that I've brought on the show.
Yay! I'm breaking new ground.
I think I've had 2 physical therapists at this point, and then I had like a business guy, like non-OT, and now I get to bring you on. So this is going to be super fun because I'm so big on collaboration and learning from other professionals and really just trying to benefit our clients as a whole, working together as a team.
Right.
And I love so much of what you stand for about diversity and inclusion, education, promoting learning and development in children, support for parents, and I feel like the list goes on and on and on.
So I have yet to pin myself down on something, but everything is interesting and important. So I'm excited to be here. And OTs are near and dear to my heart because when I was a brand spanking new out of school grad student, just finished, my first job was in a skilled nursing facility. And I, of course, had no idea what to do. And I had an occupational therapist who had been working, I think about 25 years at that point, at least. And she was from England and had been trained in dysphagia. So I had right there with me all the time this amazing woman who taught me so much about feeding and feeding techniques and swallowing. And she wasn't a speech pathologist. And so she really was my CFY supervisor, like the person who taught me the most about patient care and really dysphagia and many of the things that I know about feeding. And so I get to talk to other OTs when one of my favorite people in the whole world is an OT. Yay!
Yeah. And you know what? As you were talking, I feel the same way. I had so many non-OTs for me right when I had started out, and actually even now too, that have been such big mentors and such big support systems. And I hadn't even thought about it until you said it. I actually had a speech therapist. It was like the exact opposite.
Oh, how funny.
When I was working in the schools and there was a speech therapist and she had been there. I mean, she retired when maybe a year or 2 after I had been working with her. So she had been there for years. And she literally just kind of took me under her wing and showed me the ropes of the school. And literally she helped me so much. So it's so funny. I was like, I totally forgot about that until just now.
I just think it's so cool when she very easily could have said, you're a speech therapist and I'm an OT and you're going to get help from your CFY supervisor. And I've been so lucky that I have never really encountered that kind of an attitude with most of the people that I've worked with. And I just love it. I mean, that's part of what has made me feel more confident in what I do in early intervention. It's just that I have never had somebody who has said, I'm not going to tell you about what I'm doing because I'm the PT. Or no, we don't need to work together because I'm the OT. And I feel like I was also really lucky in the time that I was starting my career that there was a lot of focus on interdisciplinary teams and working together. And I got to do a lot of co-treating and we just kind of focused on people as a whole, as opposed to this is your speech land and this is my OT land. So I don't know. It's always just been really important to me to have us all kind of look at somebody as a whole person and work together.
Yeah, 100%. Yes. I really kind of hate that. I don't know if it's a competitive thing or this is my domain and that's your domain and you can't do what I do. And I I can't stand that kind of belief and that value that some people I've encountered it with other therapists. And it's like, but if we can all work together, like we can beautifully be addressing all of these different things. And it makes your job easier. It makes my job easier. And really we can like highlight the distinct value of what we all bring to the table by working together rather than like just not being able to accomplish all of our goals because we need everybody else in order to do that. We need the other professionals to really meet all the needs of our clients.
Right. And the more I learn about swallowing and especially with little ones, the more I realize how we kind of tend to leave physical therapists out of the swallowing equation, and core strength and chunk control makes such a difference for little ones that I'm like, okay, wait a minute. We need to start dragging, whether or not they want to. We need to start, politely inviting our PT friends to help us when we have kiddos, because the positioning makes such a big difference. And then building the core strength, because all of the structure of your swallowing mechanism is resting on your chest, and that needs to be supported by your core. So when you are weak there, it has to have an effect on your swallowing mechanism. And I think we kind of forget that these pieces don't function on their own, that everything works together as a package.
Mm-hmm. Yes, I feel like so often, and this can go across the board, but since we're specifically talking about feeding and swallowing, like so often people try to compartmentalize like, oh, it only has to do with the mouth, or it only has to do with the stomach or anything like that. And it's like, well, but first they have to be able to like see the food and grab the food and bring it to their mouth. They have to want to touch it. They have to be able to support themselves so they can eat. Like, and there's so many kind of like deeper levels that a lot of times, and I see it with like my parents and that kind of stuff, where they're just like, but you're not doing any feeding right now. And I'm like, whoa, I'm going to get there. But first we have to address the core strength. We have to address that kind of all these other sensory stuff and everything else that's going on. So yeah, it's very easy to just think it's one thing and not really pay attention to the bigger picture.
Yeah. I had a great conference that actually was a speech pathologist and an OT together. And
no wonder it was great.
I know, that's what was awesome. Could you get any better than that? But it was really cool because they talked about how important it is when we're helping children learn to eat. Well, I guess this applies to adults as well, but it was more of a pediatric class. But lots of times when we're feeding kids, we scoop up the food and we just put it in their face, or we hand them the drink and it just gets to their face, and they don't have all of the other sensory input that goes in with like what you and I have, where we see with our eyes, the cup is sitting there and we think, oh, we're about to drink. And that cues our brain, hey, I'm going to drink something. And then you have everything that goes into picking it up. And all of that is priming your swallowing system. And then you put the cup up to your lips and you smell what's in the cup. You feel the cup on your lip, and you have all of these different parts of your sensory system that are working together to prep you for the actual mechanical part of the swallowing. And I think that we forget sometimes to incorporate all of those different parts and pieces, especially because we often are in a hurry. And, parents have busy lives and they're trying to feed their kids. And I'm like, whoa, we got to stop and take a step back. Even if you just take a minute to prepare your kiddo for the fact that they are about to start eating, so that their poor little brains can go, whoa, okay, this is going to be an eating experience. Let me get prepped for that just mentally so that I'm ready to do the parts that I can do here, or help them hand over hand. I love hand over hand on a cup or hand over hand on a spoon, and getting the spoon to their mouth and then letting them kind of think about it for a minute and then helping them get the spoon into their mouth, because they get so much additional feedback that their swallower has its best chance of working, because it's not just trying to function in a vacuum.
Yeah. And I think too, like just kind of in the same vein, like I feel like so often like parents will just cut up food and just present it. And I love just handing the kid like a whole avocado or a whole banana. It's not peeled, like it's not open, there's nothing. And just putting that kind of in their space and letting them look at it. And then all of a sudden, like slowly starting to peel the banana and like doing a little peekaboo of like, oh, look what's inside. And then like cover it back up. And then all of a sudden they're like, oh, this is interesting. They're like, oh, what's that? And then they like start to engage more, even though like they're not just going to like take a bite out of the unpeeled banana. If they
Right.
do, I mean, okay,
Yeah.
it's fine. They're going to
a
learn.
learning experience.
Yeah.
That's okay. It's not going to kill them. They'll be like, ooh, take note. Don't eat the skin.
Right. But then you just tell them, oh, that's the skin. Now look, if you peel it, now try it. Right.
Yeah.
But like so often the food just magically appears, like what you were saying. And the kids are just like, oh, this is so much what's going on. And my favorite is the credit card feeders.
That cracks me up.
And every time
I think I've heard that term before, and I totally love it. I've never heard that. I love it.
Yep. Oh, yes. Every time that I mention it, like the first time I mention it when I have a student or something like that, they're like, what are you talking about? I'm like, a credit card. Like you stick it in, you pull it out really fast. And like the kids are just like, what's in my mouth? What's going on? So yeah, I secretly love when I get those parents because I'm like, okay, hold on. We need to back up. We need to slow down. And no credit card feeding here. Like this is an experience. This is a learning opportunity. And yes, it's going to take some time and we're going to get messy too.
I feel bad because I feel like our society, everything moves so quickly. And the time that families really have to sit together and interact, it's dwindling with all of the busyness that we've created. And it's no wonder that kiddos are having the challenges that they have because we really don't have the time or don't take the time to sit and experience the feeding event. If you can take some time, I always tell families, I'm like, you don't have to do this. I know you're busy, but if you can pick one meal a day where you're going to say, I'm going to actively work on incorporating all of these things into this meal. If it's snack time, if it's breakfast, if it's dinner, whatever works best for your family. But if you can just stop and take a breath for one meal a day and try to work on these things, then when that gets to be a little bit more familiar and it doesn't take as much time, then you can start incorporating these kind of other levels of complexity. But it's just so hard. I feel bad sometimes when I'm, telling a mom that has 4 other kids running around like, oh, here's the deal. We need to be sitting at the table and try to spend 15 minutes like really focusing on this. So I always tell families, I'm like, this is the best advice I can give you. But honestly, you're going to have to figure out what works for your family. And if you find that this doesn't work for you, then figure out what does work and we'll see what we can do with that.
So important because yes, we can tell our clients and our families exactly like this is best practice and this is what you should be doing and this is what I would recommend for you professionally. Right. But if it doesn't work for them, then it's not the best information for them. And somehow we as a therapist have to work with the families to get them to be able to do the things that we think would be beneficial for the child or for the client and not be a burden on their routines and on their daily structure. And yeah, it's one of the hardest parts of our job, but it's like I think it's like one of the most enjoyable parts when you can actually get like that breakthrough where it starts to make sense and they can start to embed some of the things and the strategies that we've been working on.
Right. When they have kind of that aha moment, when they're like, okay, this is a pain in the neck to have to do, but I understand that if I take a little bit of time to work on this here, then eventually it's going to be just kind of part of our routine. And then I can not have to take 15 minutes to do this.
Yeah. Funny story. I remember I had a kiddo that there was a lot of sensory stuff going on with the feeding specifically. And that child just needed to explore and touch and just get messy. And I remember when I was telling the family, like, okay, you have to allow them to explore with the food and touch the food and play and put it all over their body, whatever needs to happen. And they looked at me and they're like, but you're not going to be here to help me clean it up afterwards. And I was like, yeah, okay. Okay. Well, and this is like the first time that had been like thrown back in my face. And I'm like, okay, what am I going to do? And I was like, well, like maybe you could put like a mat down or you can strip them down, like take their clothes off so then you can just wipe them down afterwards. And the next time I showed up, and I loved this problem solving by the family, we're talking about it and they're like, so guess what we did? We just went and we did all of that sensory play in the bathtub. And I was like,
what a good
perfect. Yes.
That's awesome.
If you want to do that, I'm like, that's great. That makes cleanup easier for you.
Yeah.
I love that you figured that out and you took that initiative and you made it work. And now that's something I recommend all the time when I'm telling, especially like the really sensory ones, when I'm telling them that they need to get messy. I'm like, I've had clients put their kids in the bathtub. If you want to do that, feel free. And actually more people have done that since then.
That's such a good idea. I usually say do this sensory play, food play, whatever, right before bath time. So you can get really messy and then just go. And, I live in Arizona, so it's reasonably warm most of the time. So I'm like, worst case scenario, put them in their swimsuit and hose them off in the backyard. But really, if you can just do that before bath time, then you don't have to really worry so much about kind of adding another task for you to do during the day. That's like clean up your kiddo after they played with food. So, but I love that bathtub idea. That's so cool. I'm super going to steal that.
See, collaboration at its finest.
Yay, collaboration.
Right now. Okay, so I want to back up just a minute because I think when you were telling me this previously, when we had talked about it, you had mentioned that you've been working in pediatrics for 20-something years now.
20 years, yep.
But you didn't always think that you were going to go into pediatrics.
No, I did not.
So I want to hear a little bit more about this.
Okay. All right. I'll tell you about this. I'm like, okay, pull up a chair and hear the story. Okay. So I was that awesome grad student who was like, I don't need to take pediatric classes because I'm not going to work with peds. And I made my advisors kind of irritated because I was like, I will take whatever I have to take, but I'm not taking any more than I absolutely have to take because I'm not ever going to work with pediatrics. And they were like, are you sure and I'm like, no, I'll take the adult hearing class. I am not taking any more pediatric language classes. I had very wonderful, who I love very much, I had 4 nieces and nephews ranging from 0 to almost 4 when I started grad school. So there was a lot of really awesome development happening in my family. And I also had been a sensory kiddo. And so I had always thought of myself as the problem child. And my family would be like, just wait till you have kids of your own. And so I was like, I'm never having kids. Ha ha. And so I was just very militantly anti-child at the time, even though I dearly love my nieces and nephews and I thought it was super fun to play with them. I just never saw myself as being somebody who was going to connect with kids and work in that environment. Some of that was because I did not get exposed to anything other than the schools for my internships. And so I kind of didn't realize that what I ended up doing for the last 20 years even existed. So yes, so I was that very militant, no, I am not going to work with children. I love my nieces and nephews, but I don't want kids of my own. And I'm sure not going to play with somebody else's kid. And I don't need to do this. But the world happens and life goes on. And it's been really interesting to me with all the changes that are happening right now with Medicare because, gosh, it just has reminded me so much of what happened in my life. I set out to work with adults, obviously. I started in skilled nursing facilities for 4 years. I kind of moved around a little bit and then ended up working at an amazing facility with an amazing, 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 amazing team of people starting in 1996. And I still to this day work with a physical therapist very closely that I met in that job. And he was also somebody who was never going to work with kids. And we just got awards for our 20 years of service and outstanding achievement in working with kids, we just think is hilarious. But in 1999, there were huge changes to Medicare because of the Balanced Budget Act. And it was just so distressing to me that what happened on December 31st, I was supposed to treat patients a certain way and interact with their families and do family training. And as of January 1st, I wasn't supposed to do that anymore because it was no longer billable service. And it wasn't important for me to do staff training on dysphagia issues because that wasn't billable time because it wasn't direct patient care. And it was scary and frustrating. And I just have always really felt like family and caregiver involvement is so vitally important to what we do, that it was scary and frustrating. And I cried a lot. And one day, my mom called me and said she saw an ad in the paper. It was a teensy tiny little ad that somebody was starting a new program doing medical therapy with children, and there was a phone number to call. So I didn't realize it. None of us realized it, but a PT, an OT, and me, all from the same place, saw this ad, and we called, and we all ended up working for the same company. And then like 2 weeks later, we all realized at our other jobs that we had started working, seeing these pediatric clients.
No way.
We're like, wait, are you working for this company? And they're like, yeah, but I haven't told anybody here yet. And I'm like, oh, me too. So it was so awesome because to start with, I had a physical therapist who was amazing, an occupational therapist who was amazing, and me. And we were a team, and we all kind of were like, okay, let's figure this out. And our boss was amazing and wonderful and super supportive. And was like, okay, what kind of training do we need to do so that you guys feel more comfortable? And how do we help you figure this out? And I think kind of my entry into being more comfortable with pediatrics is at that time, the company that owned the skilled nursing facility also owned a rehab hospital that had a pediatric unit. So I was able to do skilled nursing and then adult rehab hospital and then pediatric rehab hospital clients or patients, I guess at the time they were patients. And it was kind of the first time that I really was like, ooh, I kind of like this medical kid thing. And this is kind of cool. And kids are kind of fun, but I was still kind of scared because of that, you had to be a certain way with kids. And I think right about the time that I was considering this job, I had a friend that worked in Head Start in a school district here. And okay, I'm just going to say it. I was snotty. I was really like one of those snotty medical speech pathologists. And I was like, I work in medical speech therapy and I don't work with kids. And that was like really not a very good attitude. I'm sorry if I offended anybody back in the day that I talked to who doesn't talk to me anymore. But I think, at the time that was kind of just, I don't know, maybe it's still like that out there where you're like medical people kind of look down their noses at school people. And I don't know that if it's still like that, but it shouldn't be because all of our jobs are vital and all of our jobs are hard. And I'm really happy that there are school speech pathologists out there that love it and are really amazing at it because I would not be. And I'm so glad that they do what they do. Mm-hmm. But it was really cool to have my friend say, why don't you come with me and see what I do? So I went with her to her Head Start program and she played with the kids and she was silly and it was fun and engaging and they sang and it was so cool. And then she showed me their goals and how she was incorporating their goals into the activities that she was doing, but the kids didn't really realize they were working. And I was like, oh my gosh, this is amazing. This is so cool. So in that moment, just like that afternoon, I was just like, oh, I can totally do this. This is so cool. I love this. And I'm so sad. I mean, I would have had such a different experience and outlook in graduate school if I had had any idea that something else existed besides just kind of the little tiny corner of pediatric therapy that I experienced in a school district during one rotation.
I think that that's something really important to highlight, especially for any students or even like new grads, people that are kind of just entering that exposure piece, because I was similar in a sense to you, except that I was pediatrics the whole way through school, but I was also very limited in what I was thinking that I was going to do. And so I didn't expose myself to a lot of the other practice areas. And I think it is just so important to really have as much experience and as much exposure, especially in a school when you're volunteering, during any of your internships and fieldworks and all that kind of stuff, to see as much as you possibly can, because you'll never know if you're going to end up somewhere until you've seen it or been a part of it. And even though I knew I was going to be pediatrics, or I had a really good feeling that I was going to be pediatrics when I started practicing, I never thought that I'd be in early intervention. So I would have thought I would be in a clinic or a school because that's what I had seen and that's what I was comfortable with.
Right.
And I'm always telling my students, just go and see it, because there have been so many times that I've had students come to me and they're like, yeah, I'm not really comfortable in pediatrics and babies. Like that just kind of, that's a whole nother kind of scary world. And by the time that they are done with their rotation with me, they're like completely in love with early intervention.
Yeah.
And I'm like, I'm so glad that you came and you did this and you got this exposure, because otherwise you would have just thought it was scary and something that you'd never do. And then of course I have students that come to me and they love their time, but they're like, yeah, it's still not going to be something that I'm going to do.
Not for me. Yeah. Well, my greatest advice that I can give students is get as much exposure as you possibly can to as many different environments as possible. And also just never say never. You just don't know. You don't know where life is going to take you. And I have actually some friends that in school also kind of followed the more medical route, and then they became parents. And they realized after they became parents that they wanted to work in a pediatric environment just because that was kind of more where their life was at that time. And it felt more comfortable to them. But, you just don't know you don't know what life is going to bring you. And now I kind of go back and think of my silly, very adamant self and go, what did I miss out on? That if I had just been a little bit more open to the experience in graduate school, maybe there's something that I would have learned. But I guess the moral of the story is that, especially in our jobs, learning never ends. So, you don't have to feel like, oh gosh, I didn't study this in graduate school, so I can't do this job. You just go, hey, you know what? I didn't study this in graduate school, but I find myself going in this direction. And so I'm going to do everything that I possibly can. And I think we have, just like my friend who took me to her Head Start program, I think we have a lot of therapists that have such a great attitude about bringing somebody in and mentoring them and answering questions and taking them under their wing and saying, how can I help you figure this out? How can I help you get better at this? How can we learn more about it? And I was just saying now, gosh, it's just amazing to me. Even when I look at the things that are posted on Facebook and Instagram, there's so much information that we have much more access to. It's readily available. Like at the time, I was checking books out of the library. I was doing interlibrary loan. Oh gosh, it makes me sound really old. I was getting my information from the pigeons that would drop it off in my front yard.
The smoke signal.
Yeah. I was opening the scrolls and I was reading what had been written. So yeah, no. But really, I just had much less access to information, and I was able to find it. And so through books and continuing education and wonderful people who took me under their wing and said, hey, let me show you this. Oh my gosh, so many developmental specialists. Just, I would not be the therapist that I am today if I did not have some super amazing developmental specialists who were like, hey, let's do a co-treat. And will you teach me about this speech stuff? I got way more out of it than they did with me teaching them. I taught them some speech stuff, but I was watching everything that they were doing. And they're they're just so amazing. And they have such a depth of knowledge. It's across many fields, but there are lots of developmental specialists that have not just scratched the surface, but a deeper level of knowledge across the field, and they are willing to share it. And if you can find somebody like that, that is just, for me, that is the best way to learn. I learn best by doing and seeing. So I think that I would not necessarily have had the opportunity to do and see in graduate school anyway. So it's just as well that, I kind of followed the path that I followed, because now I am here. Yay!
And I feel like a lot of times, like, I love how you were saying about Instagram, social media, and just like the people in the community and being able to kind of build those bridges and connect with people and learn from each other. And this goes back to the very beginning of this talk of really working together as a team. And especially because I think sometimes if you're a student or if you're working, you might not be getting that support on the job, but there's so much outside that you can kind of take some responsibility to learn on your own time too. And I know that time is of the essence and it's super important and we don't have a lot of it. But there's so much information and there's so much positive kind of growth and positive encouragement that can be out there, that even if you're not entirely getting that maybe from your job specifically, that you can be reaching out to other people and learning from them and continuing your growth kind of on your own, that then you can kind of bring back to your work. Because I know that there are times that maybe your supervisor or maybe it's a fieldwork educator or something like that isn't giving you specifically what it is that you need, or maybe what you think that you need, or how you kind of want them to interact with you.
Oh, don't get me started.
Can of worms.
No, I think you are correct that oftentimes, especially, so I have such a heart for students, because I think I wrote an Instagram post about this, that I didn't realize it. I am dumb, but I went to the state university. I went to University of Arizona. I went there because that's where my dad went, and that is where you went in my family. I did not realize at the time that I was applying to and attempting to go there that it was like ranked third in the nation. That was very dumb. I don't recommend that you do that. Please plan ahead better than I did. But again, there was no information out there. I had to go to the library and try to figure out like who had schools.
That pigeon was a little late getting.
I know the pigeon was late.
Yeah.
Yeah. So I did not get the memo. But then I did find myself in graduate school with like everybody else who had been the top students in their universities. And I kind of feel like they felt sorry for me because I was married and I already lived in Tucson. And so they probably just let me in. Okay, not really. But it was scary because, it was very, very competitive. And at midterms, the person that I had become closest to disappeared. She did not show up for a midterm exam. And I called her and I went to her apartment and I knocked on the door and I knew her car was there, but she wouldn't answer the door and she wouldn't answer her phone. And nobody at school knew what was going on. And basically she just disappeared. And it was super distressing to me to be her friend and not have somebody kind of reach out and be able to say, I don't know if I can do this. But in that super competitive environment, you didn't say stuff like that, even though we were all thinking it. So I just remember what it was like to have her just disappear. And I think all of us, oh gosh, we just practically killed ourselves in grad school, but that's kind of just what grad school is. Now I would be much easier on myself and say, what you learn is way more important than what your grades are. Not that you shouldn't pay attention to your grades, but, don't kill yourself because you got a B instead of an A.
Or an A minus.
Or an A minus, yeah. I know, a B plus. Oh no. But really, if you think what are you getting out of the class and not quite be so grade oriented. So that's one thing for me that I think we just, in our United States education environment, we kind of set up highly competitive environments. And yes, you want the best students and you want people who are going to be good therapists and you want to train good therapists and you want us to do a good job when we go out there. But sometimes the way that we are trained in the traditional academic environment can be traumatizing. And that I don't think really helps us be better therapists. I think if anything, that gives us some baggage that we kind of have to figure out how to deal with when we get out of school. I think when we talked before, I told you that in my group of speech therapists in my year, there were, I think 15 of us that studied together on the track where we were not doing a thesis. And we had to do comprehensive exams. So we spent a lot of time studying together. And just in that small group, within the first 3 years, I was trying to think about this more specifically. I think within the first 3 years after we got out of grad school, that 5 of us had stopped working as speech pathologists. And I'm like, wow, we spent a lot of time and money going to this amazing speech program only to get out and be so struck by the actual business of doing healthcare and or the business of working at a school that we did not even continue to work in this field. And there are some of the ones that have come back after they had children and they decided that they were ready to kind of move back into either a school environment or a clinic where they were working with children. But that's pretty big when you have 17 people and 5 of the 17 end up not working as speech pathologists because they either didn't know what they were getting into, or it was too stressful, or they had a different expectation for what life was going to be like when they got out of school. And I just don't think that in general students are prepared well for the idea that, we all want to be therapists because we like to help people and we want to do something good. And I think, the relationship that we can develop with people and the opportunity to help them grow. And I don't think that business fits very well with that. Mm-hmm. And so we get out of school and we're like, yay, we want to help people. And then they're like, ooh, what was your productivity this week? And we're like, what? Oh, wait a minute. But Mr. Jones really needed some help. Oh, sorry, Mr. Jones only had an hour and you were with him and that wasn't billable time. So now what are you going to do? So, and I think that there's always going to be kind of that shock. I know physicians have that same kind of experience that, school is one thing and their residency is another. And then they get out and just, they want to help people. And then they figure out that their hands are going to be somewhat tied because they're working in an environment that at its core is a business. So I just kind of think we should do a better job of preparing students for what actual paperwork is really going to be like. And yes, you could do a really incredibly thorough 15-page quarterly report, but is that what it's going to be like in the real world? Not necessarily, but I understand we need to know how to do it well and then be able to pare back for the real world. And then understanding the business of therapy, the business of healthcare, and then the politics of school environments, because I don't think that we're preparing students for the politics of school environments either. And that's just a shame because we put so much time and energy into education and learning to be the best that we can be. But then we kind of send students and new grads out there and just say, okay, well, hope this works well for you and you find somebody who can take them under your wing and
have fun.
Hope it goes well. Bye. Yeah. So I don't know. I just wish that there was a little bit more. And I think that there are grad programs out there that are starting to incorporate a little bit more information about kind of the realities of the work environment, but I wish that it was more universal. And my other big soapbox. Oh, this is the other one.
I feel like, there were two things that really kind of stuck out to me as you were talking right there. And the first thing, and like, as you're talking, I'm nodding my head at so many things. And unfortunately, I'm nodding my head because I've heard it before.
Yeah.
There have been so many amazing students that I've come in contact with that, they're brilliant. They're amazing. And they get out into the field. And within a year, maybe 2, they're already coming to me saying, I'm burned out. I don't even know if OT is for me anymore. I want to do the best for my clients, but I'm bound because of productivity. I'm bound because of timing and the expectations of my job and the lack of support that I have from supervisors and from mentors. And it's so disheartening to me because I know how amazing they are. And I know that they have the passion to do good work and to help the clients, which is ultimately what our job is about. But because of all of these kind of outside factors, they're considering leaving the profession. And that just breaks my heart. And like the other thing that you were talking about was getting this exposure to the realness and the reality of what practice in the quote unquote real world looks like when you are a student, when you are a new grad, and really kind of coming to terms with it is not just rainbows and butterflies and sunshine all the time. Yeah. And there are so many difficult things that we as practitioners, whether you're in speech, whether you're in occupational therapy, whether you're physical therapy, whatever profession you're in, that we get exposed to on a daily basis that can really take a toll if you're not prepared and then think that you can go change the world. And all of a sudden you're like, what did I just get myself into?
Yeah, it can be shocking. And I think some of where we fall down on that is when we're training students during their internships or their externships, whatever you call it. I had some really bad supervisors. I hate to say that, but in the medical environment, when I was in my very first medical internship, would have been a good time for me to learn more about the business of speech therapy. And yes, she did talk to me about productivity and the importance of billable time and billable hours, but I didn't totally get it because I think it's hard for us when it's completely new information and it's something that we are just barely scratching the surface of. Sometimes it can be described to you and you don't get it because there's a lot of understanding that goes behind what that person is saying to you when they're talking about billable time and units and direct patient care. And so you don't really realize that you don't know things about that. So you don't know what you don't know. My medical supervisor was somebody who I think saw her students. She was a nice person, but I think the facility and that person in particular, who was my supervisor, she saw the students that came to do internships as like free help. Yes, they were really busy. They had more patients than they had staff to see. So they needed therapy students to provide services for their patients because they didn't have enough staff to cover everyone who was there. And I was like, this is my first medical internship. I'm sorry. I didn't do this in undergrad. I haven't had an internship in a medical environment before. This is completely new to me and I'm kind of being taught from scratch. But she didn't realize that that's what she was getting, or just thought, well, gosh, I don't have time to teach you all of this. So you're just going to have to step up and do it. And it was frustrating because I felt like I didn't have an opportunity to say, I don't understand this, or can you help me figure this out more? Because when I did say that, it was like, you're an idiot. You just, what's wrong with you? Maybe you shouldn't be working in a medical environment if you don't understand this. So, it's just frustrating because I understand that they're doing a service and helping students have a place to come and have these experiences, but don't take a student if you don't have time to take a student. And I feel like sometimes that students are just looked at as free help. And we're not really stopping to sort of vet the person who is being the supervisor and seriously to look at the environment that we're sending students into, because we're just desperate to get the experience so that we can graduate. So we're like, okay, wherever I can go, sure, that's great. In a perfect world, we would have somebody who is a really good teacher who is being a clinical supervisor in the field, and they can provide that additional education and then take some time to help you see a little bit more about the realities of working in a healthcare environment or in an educational environment. And I wish that was something that we had the luxury of maybe paying a little bit more attention to, I guess, as we're educating new PTs and OTs and speechies.
Yeah, I really think that's kind of one of the valuable parts of us having this conversation right now, is really bringing this difficult conversation. It's hard to talk about some of these harsh realities that are going on within our fields right now, especially in terms of supervision, in terms of learning and student mentorship and all that kind of stuff.
Right.
And yeah, I think it's really important to talk about and really try to instill in other therapists that might have students right now, or maybe are considering taking students, and also in the students themselves, to understand kind of all of these kind of complexities that are going on as you are learning as a student or as you are being a supervisor to a student. And I think one of the things that you were saying, and I think this is such an important part for the therapist, for the supervisors to understand, is that especially if you've been practicing for years and you've been in that practice area, you've been in that setting, you know the ins and outs of everything. You know your job, you know your clinical role, you know the business side, you know everything about that area. And then you get a student that's coming in and maybe they've never been exposed to it before, and they want to know, they want to learn. They might not know exactly what to ask in the beginning, and they're there to get exposed to it. But we as the supervisor have to take a step back and try to figure out where that student is at that moment, and then adjust how we teach them and what we're exposing them to the level that they're at that moment. Because if you have, for OT, for the level 2s, it's a 12-week rotation, like internship. And so at week 1 compared to week 12, you can have a completely different conversation with your student, because now they have all of this experience and understanding under their belt.
Right.
But at week 1, if we just start kind of barking all of this like harshness and reality and all of these like super technical things where the student's like, I don't even know where I'm supposed to sit in a session.
Right.
It's very hard. And I think a lot of times we have a disconnect between the supervisors and the students, that they're not meeting where the student is at that moment. And
right.
I know for me, like I'm constantly asking questions of my students to gauge where they are in their learning. And if they're asking me very simple questions, then I know I have to go back to basics and get them to understand it. But if they start asking me these kind of higher level, more complex, just like deeper understanding questions, I'm like, all right, like,
okay,
I'm jumping in the weeds here, because what you are asking means that you've put some thought and you already understand the foundational level of knowledge with whatever that question is.
I so appreciate that you think that way, because it has to be okay to have students that come in at both levels. It has to be okay for students who have absolutely no clue what they're doing to come in and work with you, and for you to kind of adjust and come down to their level. But it's also got to be okay to have somebody who is super good and asking you really complex, higher level questions, and maybe is ready to work more independently sooner. But I think the problem is when we have an expectation of what we're going to get in a student before they come, and we don't stop and really take a look at that person and be willing to adjust our expectations for what the experience is going to be based on what their needs are. We kind of look at it, I think often supervisors look at it from here's what I need from you, student who is coming into work in my job. And we set ourselves up for a frustrating and heartbreaking experience, because we are looking at what our needs are instead of looking at what our students' needs are and where they're coming from and how we can meet them there and then bring them gently forward. And maybe they're expert. Maybe they know more than me. That's awesome. That's very cool when that happens. I can learn a lot. That's great. I love it. But that clinical experience, when you agree to take a student, it ceases to be about you. It is about your student. And if you're not willing to be a clinical supervisor and have it be about your student, then just don't be a clinical supervisor. It's okay. It's not required. You don't have to do it. You can do it if you choose to. In fact, in my job that I have right now, for the most part, I choose not to, because I feel like I don't have a broad enough caseload for somebody to really get the experience that they need to have. And I'm a little bit more, my caseload's a little bit lighter right now. So they just won't get the experience that they need to have. So I choose not to, even though I love supervising, but I can't really give somebody the experience that they need right now. So it's in somebody else's best interest for me to say, I would love to supervise you, but I don't have a good environment to be a supervisor in right now. But here, let me try to connect you with some other people who I know do. So I hope that we can try to persuade people to think a little bit about what their responsibilities are in agreeing to be a supervisor. That would be nice if we could maybe kind of think through that a little bit more, because who doesn't have the really scary supervisor experience? That just seems kind of like a requisite part of graduate school.
Yeah, but why? I
know.
I don't understand why that has to be a thing, because I feel like, yes, by going through some negative supervisory stuff when you're a student or a new grad, yes, you're going to learn from it and it's going to change you and affect you. But I think there's going to be a lot of like emotional baggage and maybe even some clinical baggage that comes along with that. And I guess I don't understand why we as supervisors feel the need to have to like put our students down or call them names or base their clinical skills on the school that they went to or the program that they're from or any of these things, where really our job should be to promote growth and development, foster their own clinical skills, foster the soft skills that they can learn to interact with people and be kind of strong and confident in themselves, rather than what I guess what I always see is like the students come in and they're hesitant, they're nervous, they're anxious, they're, insert all of those words here when you're first starting to go on a rotation or an internship as a student. And then all of a sudden, because of the relationship with their supervisor, but because of how their experience has started off, now they're afraid to ask questions. They're second guessing themselves. They're putting themselves down. They feel like they should know the information and they don't know it. And that just spirals into something that could have easily been avoided if we can just build from the bottom and build that positive foundation rather than knocking them off before they even get started. And all of a sudden, they're just on this vicious, downward spiral. And it's really hard to kind of overcome that.
Right. I think that sometimes you get started on that and then it almost becomes a self-fulfilling prophecy that you're going to fail because you get locked into that second guessing. That happened with me in medical, in the medical internship. I became so convinced that I did not know anything that I must just be stupid that I was like, oh my gosh, I don't even know if I can be a speech pathologist. And it was so hard to get pulled out of that. But thank goodness I had some really wonderful people that stepped in as CFY supervisors. And then Marilyn, my wonderful OT friend, who were like, I don't know why you think this, but that is not the case. So, I think it's just a good thing to realize how much one person can impact someone else's life. I think we kind of think, oh, well, you're going to do, 6 or 8 different internships, externships, observations, whatever, and I'm just one of those. But you might be the one who changes their life for the better, or the one that they're telling the story about 27 years later. You don't want to be that one, but they will not forget. I know, it's just that the whole training. I mean, I could talk to you for 3 hours about the whole training thing. I feel like we're missing a component of kind of some of the behavioral science that goes with the idea of being a therapist, teaching us how to talk to the clients that we work with and how to deal with parents and how to take into consideration different personalities and behavior management. I mean, I think that's a huge thing. That maybe I would have gotten some of that if I had taken a pediatric class. Whoopsie. I don't know. I don't think my other friends got that either.
And I think too, it's also getting that right exposure.
I mean, I think in general, really just being willing to look at how our educational programs are designed and the coursework. I think really just being more aware of kind of what we're putting students through from an emotional standpoint, and then kind of being able to take a step back and go, how are we setting up the internships? How are our students getting their externships? And what are we doing to kind of ensure that that's a good fit for them? I think that's really the important stuff.
Yeah. And I think too, and I'm curious to know if you've either done any of this or if you've heard of any of it kind of happening in the speech world, but I know in the last couple years, there's been a really big push for Fieldwork Educator certification courses and lots more support for Fieldwork Educators. And I have found so much value in going to those courses and presentations and conferences from the Fieldwork Educator standpoint, because I start to learn all of these things that maybe I hadn't considered before, or learning effective ways to give feedback, effective ways to ask questions, and really taking more initiative to understand the student perspective. Because now I've been out of school for 10 years. So the further I get out, the harder it is for me to remember and relate back to what I was doing. But really kind of continuing that learning from the educator standpoint of how we best can work with our students and help them, because I love what you said. It's ultimately about them. It's not about us. It's about them, and then facilitating their growth so they can go out and continue to do a good job with the realm that they are going into.
Right. I think for certain that is an area that's expanding and growing, that ASHA, the American Speech and Language and Hearing Association, is doing a lot of work and trying to help us have more resources. They have some great information on their website. And I think that we are trying to help supervisors in general be more thoughtful about the process. I just think that it's a challenge, in a business environment to have students trying to learn. And I think it's also important for us to realize that just because you're a good speech pathologist or just because you're a good OT does not mean that you are a good teacher/supervisor, because that takes a separate set of skills. It's different. The things that you need to do to be a good supervisor, to take somebody's hand and really impart some new information and lead them through experiences that they have not had before, is a different skill set than kind of what we normally do as an everyday therapist. There's a lot of things that overlap, but just the way that you implement some of those skills is different when you're doing it with a student. And so, I just hope that I just want to say, it's okay to say, I'm not a good supervisor. There's no pressure to be a supervisor. You don't have to do it. You don't have to be a clinical supervisor. It's okay to say, you know what? I have my hands full with my caseload. And I just don't really want to take any more students. And that's all right. It's totally fine. I think that sometimes we feel like that's something that has to be part of our clinical growth, that is part of our career. If we are really a good therapist, then we must be being a clinical supervisor at some point in time. And for some people, that's a great fit. And for some people, it's not. And we just need to be okay saying, for me, it's not a good fit. That's all right. It's fine. And that's not a vital part of your career. If you choose not to do it, that's great. But if it's something that you enjoy doing and you find that you really have the skills to do it, then let's see what else we can do to support somebody in that position from the university standpoint, and then from our association standpoints too.
And I think too, it also depends on like where you are as a therapist in that moment, because as you mentioned, you said you aren't able to take a student right now, or you feel like it wouldn't be the best environment for them. And I love taking students, and I've taken students almost every single year that I've been a practitioner, but I went through a brief time period where I wasn't able to take a student because I was working as an independent contractor, and one of the companies said no to a student and one of them said yes. And I'm like, but that's only going to be a part-time schedule. And
right.
it would have been chaos. And even though I wanted to, I knew that it just wasn't going to be the best fit. And then also even within, I want to say like the first year of me starting my company, I was like, I'm barely getting by here, like just trying to figure out how to run a company and how to get everything set up and building my caseload. And even though at that point, I also wanted students, I knew that it wasn't going to work at that moment. And so it doesn't have to be like an all or nothing. It can be, you can take them when you feel like it's a good learning environment, when you feel like you as a therapist can take the extra time and have that kind of that headspace to be able to take on a student at that moment, and not just, well, I've had him in the past. Well, I can't do it now, but I need to because that's my identity. That's what I do. No, you have to figure out what's going to work best for you as a therapist and an educator in that moment too.
Yeah. I don't mean to say that every school and every situation is bad. I feel like I sort of sound like I'm being negative Nelly about all of the clinical supervisory situations. And I know that that is not the case. And I know that the majority of them are good experiences, and they're people who they genuinely really want to help students and they want to be the best supervisor that they can be. I totally respect that. I understand that it's out there. I commend everybody who is willing to do it, because it's a lot of work and you don't get paid for it usually. And it's something that your heart gets fulfilled and you know that you've made a difference in someone's life. But I just feel like that because we can all say, oh yeah, we had the bad experience, that it's common enough that there's still more work to be done. So I think in general, it's much better than it was. It's moving in a positive direction. But because we can still kind of all, even like younger, like you, who, you've been out of school for 10 years, but you can still go, yeah, I had the not so good experience. So what can we do to kind of change that so that the expectation isn't that, oh yeah, you're going to have some bad clinical experience, but you'll have some really good clinical experience too. Let's change it so it's all good clinical experience. So.
Even if it's hard, even if it's pushing you to your max, but it's still a positive learning environment, even if it's hard, rather than just a toxic environment that makes you want to leave the profession or think that you're no good or whatever it is that it makes you feel. And even though I've been out of school for a decade now, I'll talk to students like when they come to be with me, and I'll ask about their previous rotations and things that they liked and things that they didn't like, and then like stay in contact with them even after they're done with me. And if they go on other rotations and hear feedback about what it is that they are going through. And I mean, there's still a lot of negativity within the student supervisor experience right now. And I think that's just one of the big reasons I wanted to have a conversation about this, to really just kind of bring it to light and talk about some of these difficulties and some of the harshness that's really going on within both of our fields right now.
Yeah. I don't think that people intend to be that way, but I do think that it's important that we know some people don't have their own awareness of their level of knowledge of how to deal with other people. I think
like having your own awareness to be aware of what other people are going on. That's like that's a tough skill.
That's pretty meta.
Yeah.
So I think maybe that's some of it, that I think the people maybe that are having not the best experiences, I don't think anybody sets out to be mean to a student. I think it just is that they probably are well-intentioned, but they just don't realize that the way that it's working is a little bit broken.
Yeah. Yeah. All right. I want to switch gears a little bit because I know we could talk about this for like 5 more hours.
3 more hours, yeah.
But there's something else that you have been up to that I want to talk about a little bit and dive into some of these books that you have written that I think are absolutely amazing. So could you share a little bit about your books, your babies?
My babies. Yes, thank you. So when I first started working with kids about 20 years ago, there really weren't a lot of resources out there that were like child appropriate in terms of the kids that I was working with. So there weren't books that had kids that had special needs. And there were books that I would end up using with kids who maybe were functioning at a lower level, but they were a little bit older. And they ended up being baby books. And I just have a hard time using books with babies, with kids that are a little bit older, just because they happen to be working on skills that are a little bit earlier in the developmental stages. They don't necessarily want to look at books that have just baby pictures in them. So I had a kiddo in particular who did not like to do work at all. He did not want to do anything. He did not want to do PT, OT, or speech. And he was very grumpy when we tried to get him to do it. And our sessions would just kind of be frustrating for him, and he would cry, and then we would all end up feeling terrible and we'd not get a whole lot out of it. And I happened to discover that he really liked this series of books that had rhythm and rhyme, and he liked the pictures, and we could tap along with the story, and he would look at the illustrations and actually talk to me about what was in them. And we could work on questions and responses, and I found that we could do a whole lot of things just by using these books. So we would sit and PT would help him stretch and do PT activities, and we would look at the books and we would talk about what we saw there. We would do vocabulary. We would work on articulation. And I thought, it would be really cool if there were books that incorporated these skills that I try to practice with kiddos every day. And kind of through that experience, my books were born, and that was around 2007. This is a whole nother podcast that we could have about the experience of having your books come to life. But it was a very long process. And I'm just going to throw out there for anybody who is interested, buckle up because it's going to be a challenge. My original set of books sold to a publisher in 2007, and they had been edited and they were being illustrated. It was really important to me that kids with special needs be included in my books. And the publisher who purchased my books had said, "Oh yes, we are definitely going to include them." But apparently that information had not been passed along to the illustrator. And so when I said, oh yeah, I'm so excited, I have kids that have special needs and I'm super excited to see how you portray them in the books, that made her very not happy. And so she contacted her agent, and her agent contacted the publishing company, and the publishing company contacted me and said, you are not allowed to talk to the illustrator because you freaked her out talking about kids with special needs. And at that time, my heart was just broken because I felt like I had these books with an idea of how I wanted them to be. And I was like, it's like somebody stole my children and they're raising them to have beliefs that I don't believe in. It was just very silly. So, but everyone was said, oh, don't worry about it. You know, the most important thing is just to get published. And once you get published, then you can do books the way that you want to do them. And it'll be much more open for you. So, you know, it's all right. It'll be all right. And I'm like, but they're not going to be what I want them to be. And it was just bad. But eventually, probably 6 months later, the publishing company was purchased by a great big giant conglomeration. And that conglomerate decided not to continue work on any of their current projects that were in process. So my books ended up being held. And after 2 years, the rights returned to me, and I sat on them for a while and shopped them around, and nobody really was interested. And so finally, with the encouragement of one of my clients' moms, who was wonderful, and they would not exist if it were not for her, said, you know, this is an amazing project. It has to get out there, and it is probably not going to happen right unless you do it yourself. And you need to think about self-publishing. And I was like, oh, no, I don't want to self-publish. That's like, and I will not be like a real live author if I self-publish, and nobody will take me seriously, and I'll just have a bunch of books in my closet. But I realized that the marketplace is really changing and our environment is really changing. And it's something that I was just able to kind of do step by step. And as a result, I have been able to work with an amazing illustrator. She was so good, so good. She included kiddos with special equipment, with special needs, with wheelchairs, with communication devices, with hand braces, with adaptive wheelchairs for the beach. She was just fantastic. Every time I came back to her and said, hey, I want to put more stuff in the books, she was like, okay. And she was game. She was up for it. She's like, I don't know if I can do that, but I will try. I'm like,
I love
yay,
that.
cool. Yeah, she was awesome. So good. Just so good. I was so blessed to have her. Her name is Jennifer Ball. She's amazing.
Well, and how important for our kiddos to be looking at a book and now see another kid that's in a wheelchair or a walker or has some sort of assisted device, where in lots of other books, I mean, I can't think of any other books off the top of my head that a kiddo could look through and be able to identify like that kid, that person is similar to me. And that's so important for all of us to be able to relate. And it's not just this human that we're looking at in a book. It's like, wow, that person either looks like me or they have the same equipment as me, or there's something that makes it relatable. And that's just so important for our kiddos and for people in general.
Yeah. One of the things that I realized as I was doing early intervention evaluations is that there were things that were part of the developmental milestones that we look for that families did not realize that their kiddos could or should be trying to do. So often parents would say, you know, I didn't realize that we should be trying to drink from an open cup, or I didn't realize that he should be using silverware. Won't he poke his eye out? Or are you sure it's okay for my kid to play in the playground? And that was something even that came out with families that have kids that have special needs that have already been identified as often families just trying to be good parents and take care of their kiddos. We're not exposing them to some of the things that we would consider a normal developmental milestone for typical kiddos because they were concerned, like, oh, I haven't taken my child to play in the sand because eek, he has a feeding tube. Oh no. And to be able to kind of say, you know, just because your kiddo has special needs doesn't mean that they shouldn't have the opportunity to be exposed to whatever a typical kiddo would be exposed to. Now, they may have to do it in a different way. You may have to make some accommodations, but just because your kiddo has a feeding tube or a walker or is in a wheelchair doesn't mean that they shouldn't have the opportunity to go play at the park on playground equipment or go to we have in Arizona, we have splash parks. There's like fountains and things that you can walk through and get wet in. And families have said to me, like, can he do that? He has an arm brace. I'm like, yeah, it just gets wet and then it dries,
Right.
and you might have to go in too and get wet. But yeah, it's okay for them to have these experiences. So I try to include a bunch of different things in the books. So I've been calling it the Hello series. It's called Hello Mouth and Hello Hands and Hello Feet. And because I'm a goofball, it's really important that you say it silly. So you have to be like, Hello Hands. Okay, you don't have to say it like that because, then you'll feel dumb. But honestly, the sillier you are, the more excited your kids are going to be about reading it with you. Hello Mouth is kids at home, and then they go to school and they have a snack at school, and then they go back home at night and brush their teeth and go to bed. But it shows mirror play, it shows teeth brushing, it shows a lot of the snacks that I use for feeding therapy in the illustrations. There's straws, straw cups, sip cup styles. There's all kinds of different things that are included in the illustrations. They're little rhymey words that I like, and they're fun to play with. But if you look at the illustrations, there's just so much more to them going on in the background. I actually just created a list that's 20 things that you can do with the Hello books besides just read them traditionally, because the action words are all in different colors. So you can, with a communication device, color code the action words. You can use, if you want to be super creative, you can create cards that go with it so your kiddo can read along with you. There's actions in all of the books, so you can have kiddos look for actions. You can ask them questions, and it's designed that you can stop while you're reading and say, hey, let's try this. So just some basic hand movements like opening your hand and doing, okay, you'll have to help me. I can't remember what it's called when you're doing like the thumb to your
opposition
finger. Yes. Okay. So thank you. Thank you. OT. I'm a speech therapist. Yay.
Hey, that's why we're better as a team here.
So there's a phrase about that in one of the books so that you can stop and see if you can get your fingers to your thumbs. So the kind of things that we would normally kind of want kiddos to do that are boring are often included as some of the cute things that the kiddos find that they can do with their hands or their mouth or their feet or their legs, so that you can say, hey, let's try jumping, or hey, let's try tapping our toes. So it's just a chance to kind of, if you want to do it traditionally and you just want to sit and read the book, then you can try to do the different actions that the kiddos are doing in the story. But if you have a littler kiddo that doesn't want to sit and read the story, there are at least 20 other things that you can do besides just read them. And I hope that they can kind of find a place in everybody's toolbox. So really what's covered in the illustrations is kind of what we expect to see between birth and 5 in a kiddo's typical milestones. And there's rhythm and colors, and there's rabbits to look for. Oh my gosh, I'm like...
I forgot about the rabbits.
I know.
I knew you mentioned something that you could find it on every page, and I couldn't remember what it was. So it's the rabbit.
So there isn't a rabbit on every page, but there are rabbits that are scattered throughout the book. And my friend's daughter, actually, she was a skeptical customer when I gave them to her.
those are the best kind, because they're going to actually look at it and like give you the feedback that you need.
She's like 18 months old. She's 18 months old. She's just learning to love books in a form other than just chewing on them. But she actually sent me the cutest picture. I love it. It's so cute. But her kiddo took the book on one of their road trips and was looking at it in her car seat in the back by herself, but she loves to find the rabbit. So she's like, I don't care. She's interacting with the book. I think it's so cool. So I just wanted there to be something in there for anybody. And everyone's like, can a typical kid use it? And I'm like, yes. Well, is it for kids with special needs? Yes. I'm like, everybody can use it, because there's kind of a little bit of something for everybody. And I didn't want it to be one of those books that was like, okay, you only can sit and do the story. I just wanted it to be something that a therapist or a parent can have in their bag or on their shelf and just grab it and be like, okay, this is going to hold my kiddo's attention for a little while. We can look at this together. We might just even look at the pictures, but we're going to get something out of it as we look at it.
And I think that's really just kind of like thinking outside the box, because I've encountered it too, where I'll bring a book out in a therapy session and the parents just like, well, what are you doing? Like, why, like, are you just going to read a story? And it's like, oh no, just watch. Like, there are
Yeah.
so many things that you can work on with a book that are outside of just reading. And I think it's really instilling in the parents of all of these different developmental milestones, but then all of these other fun, playful, and just very typical things that we can do with our kids using the book, but also with doing so much more with it. And so the illustrations are beautiful. I love that it's based on a lot of the kiddos that you know and you've worked with.
Yes. My kiddos that I love. Yes. In fact, the kiddo that was part of my inspiration that got me to write these in the first place is in the books. He has curly blonde hair and he wears a striped shirt. So he had to be in the book. All of the characters in my books are real children. There are kids that have special needs, and there are kids that were typically developing kids. There are siblings featured in the books as well, because I don't know if you've had this experience, but I have had some really fantastic siblings that have been my lovely assistants or my handsome assistants.
Always.
And that has been so fantastic to be able to say, look, that's his sister and she's helping him just like you help your brother. That's so cool. So I wanted to kind of have a little shout out to the siblings that kind of sometimes find themselves not getting all of the attention because they have really complex and demanding brothers or sisters. I was so thankful that my families with kiddos that I've worked with for quite a while were willing to let me use their kiddos' likenesses from when they were young, because I think for me, at least, I know that those kiddos are real. And I know that they had some of the experiences that are in the books. And they are kids that maybe you wouldn't think would be going to the beach. One of the clients that I've seen for a while, who I dearly love, is a beautiful little girl that gets to go to the beach in an adapted wheelchair. And that's what she does. And she loves it. She just has such a great time when she's at the beach. And I love that she's in the book. And it just makes me hope that families will see that and be like, oh, wait a minute, this is a beach adapted wheelchair. Maybe that's something that my kiddo can do too. And I wrote on the back of the book, there's instructions, just some really basic ideas, interaction ideas on the back of the books for parents who this might be new to, because I know, kids don't usually come with an instruction manual. So it's kind of the instruction manual that I'm like, everybody should leave the hospital with one of these.
Right.
This is what your kids should be able to do. And here's some ideas on how to do it. So one of the things that I really like is that there are kiddos in the book that have some different needs and you can identify them, but there are also kiddos in the book that are typical. And there are kiddos in the book that have some special needs, but they are not easily identified. So there are children that have autism and they're not easily identified. The thing that I love is that they're all in there together. So there's kiddos with special needs and there's typically developing kiddos and there's siblings and they're all in there together. And it doesn't matter. They're not separated by groups of who can and cannot do certain activities or events. They just are all together. And I think it's important that we remember that really, honestly, I think it's important for us to remember that everybody has a body that's complicated. All of our bodies are complicated. Our bodies don't work in the same way. And we all make some accommodations, even if we're a typical developing person. A fantastic mom told me that. She said, I always tell my son, your body's very complicated and we just need to figure out how to make it work for you. And I think that's a really important thing to remember as we're working with any of our clients, whether they're children or adults or in between, that we all are complicated. We are only limited by our ability to figure out how to make something work. Our creativity is what allows us to participate in anything that we might choose to do. We just have to figure out how to make that work. So I hope that families can, as they're reading, just be inspired by the pictures that they see and think, okay, yes, my kid has some different needs and his body's complicated, but that doesn't mean that he can't participate in this activity. It's just going to be a little bit different. And I hope that families can have that sense as they're reading, even the words that cover some very specific things, like my feet help me walk. I know not all of the kiddos in the book can walk, but we can still take their feet and help them move their feet in a walking-like motion. For dancing, the kiddo that's in my book that's in the wheelchair, she loves to dance. And I do say my feet help me dance. Her feet don't help her dance when she stands on the ground, but her feet help her dance in her wheelchair when she moves her feet around and she shakes her hand.
I was literally going to just bring that exact picture up because that's what came to mind. So I'm so glad that you mentioned it.
I hope that it will just help families think outside the box a little bit more about what they can do in their family activities and just in general with their kiddos, that yes, there are some limitations and some of them are going to be way more complicated than others, but we all have limitations, and really we're only limited by our creativity and our willingness to kind of be flexible and try to work with what we have.
I love that. And I love all of the thought that you put into these books, from the milestones, from development, from inclusion, from diversity, from the siblings' point of view, and everything that you've just talked about. I absolutely love just how much thought went into these absolutely beautiful books. And I wanted to ask, if people wanted to go check these books out, where can they find them?
Right now, the place to find them is on Amazon or on the publishing website. So you can find them on Amazon.com, obviously. It works best if you search by the title and my name. So if you search for Hello Hands by Connie Hunt, then you will find them, because there are a lot of books called Hello Hands. And because mine are new, they're not going to pop up on the top. But if you put the title and the author together, or you can find them on my website, it's www.positivefoundationspublishing.com. And you can reach me at Connie Hunt at positivefoundationspublishing.com. And then I've tried to kind of consolidate social media on my Facebook page that's Positive Foundations for Kids. And I picked the name Positive Foundations because I feel like we sometimes get wrapped up in all of the cool therapy tasks that we need to do. And I think sometimes we jump to the stuff that really looks like fancy schmancy therapy, and we forget that we haven't built the foundation that we need that's going to carry all those skills forward.
And I think the name Positive Foundations has so much connection to what we've been talking about today, from our clients and their families to the students as well. Building the positive foundations across the board to be able to be functional and competent and confident. And, I could just keep going on and on and on about that.
Right.
And yeah, I absolutely love it. And okay, so I have a question, and this is going to be fun because typically I'm asking other OTs. So this is going to be fun for me. If you could only have one word to describe occupational therapy, what would it be?
Functional. I don't know. That's probably what other people have said, and it sounds stupid and cheesy, but really, honestly, functional. I think that's one of the coolest things about occupational therapy, is that at its core is basic, everyday functioning. You guys help people get the business of living going, and it's functional.
I love it. I love it. And I have to ask, just in closing, because I see this little thing on the screen and I have to ask about it. It looks like something from Star Wars here.
Yes, he's here. I have I think someone might say an obsession. I would just like to say an enjoyment of, an admiration for, a fascination with R2-D2. I love R2-D2. He's here. My husband started it. I did a play about 15 years ago, and my husband I've always loved R2-D2 from the moment that I saw him on the TV commercials. I was like, I must see that movie because I need one of those. I think he's beautiful. And my house is decorated in R2-D2 colors. My car is R2-D2 colored. Okay. All right. It's a little bit of an obsession. It was not intentional. It just happens to be that I really enjoy the colors of blue and silver. And so it just kind of worked out that way. But I think one of the things that I love so much about R2D2 is that he doesn't speak, but he communicates and he saves the world, even though he can't speak multiple times. So I'm like, he's like my hero because he never says a word. But if you think about his little beeps, we totally know when R2D2 is angry. We know when R2D2 is sad. We know when he's being snarky. We know when he's laughing. And it just reminds me, for some of the kiddos that I work with and some of the adults even that I've worked with, that sometimes it's the importance of our communication is not specifically the words that we're saying. It's how we sound or how we look. It's all those nonverbal aspects of communication that come in and make a difference for us. And I feel like sometimes we get, especially speech therapists, we get hung up on speech. And that's such a tiny little component of the whole communication package. So R2 reminds me of the importance of communication.
I love it. And with that, I just want to say thank you for coming on and chatting with me today. I had so much fun and I got so much value out of the words that you shared and the topics that we talked about today. So thank you so much, Connie, for coming on today.
Oh, thank you so much for having me. It was super fun. I could talk to you for hours. It was great. And I'm so honored to be your first speech pathologist and hope that there are more to come.
Yeah, first, but not the last.
Yay, first but not the last. That's a great attitude. I like that. Thank you very much for being accepting to us crazy little speechy types.
Hey, you put up with us OTs, so
we're an awesome package. Cool. It's an awesome package. PT, OT, speech, we go together. It's a very important thing.
Thanks for tuning in to today's episode. To win a copy of Connie's book series, head on over to otforlife.com/hellobooks to see the instructions. You'll get an entry into the drawing for each of these actions. 1. Subscribe to the OT for Life email list. 2. Follow both OT for Life and Positive Foundations on Instagram. 3. Find a password in the podcast, one in the Instagram Live and in the Instagram Takeover. If you do all 5 actions, you'll get double your entries up to 10. Your password for the podcast is R2D2. So head on over to my website and remember that's OT, the number 4, LYFE.com/hellobooks to find the instructions and submit your passwords there. Hey, before you go, I just wanted to say thanks for listening to today's episode. If you want to further the discussion, go to our website, otforlife.com, and join our Facebook group. If you like us, here are 3 easy ways to let us know. 1. Share our podcast with a friend, colleague, or anyone interested in occupational therapy. 2. Leave us a review on iTunes or anywhere this podcast is found. 3. Subscribe to us so you don't miss out on any upcoming episodes. Thanks again. We'll catch you next time, OT for Lifers.
Sorry, just a little bit of snoozy rambling.
No, you know what? I think both of us actually held that together pretty good. And I just realized that I don't even know if you noticed it, but could you see my husband in the back?
I could. Hi.
Yeah. Well, and then you see this, which you probably can't tell.
Oh, yeah.
It's like a big, hanging IKEA lamp.
Yes.
So it looks like he's fishing.
He hasn't caught anything, though.
The other really funny thing that I've been wanting to tell you this whole time, I'm like, I have to wait till the end, is, okay, the way that you're positioned, I can only see half your face, but your mic is out here.
Yeah.
So you have dark hair and then a dark curtain and then a dark mic. And it actually almost looks like you have Princess Leia.
Princess Leia.
And the whole time I'm like, I know. My God.
I did notice that. I'm not quite sure how to say it right, but it's hard for somebody to see the value. Sorry, I'm knocking stuff over.
No, you're fine. Don't worry. And I was like, I'm not going to interrupt her. I'm going to let her keep talking, but.
Good job. Way to have self-control. I'm so squirrely. I would be like, oh, wait, I have to tell you. Oh my gosh, this is amazing. Let me talk to you in great detail about R2D2. Here's my R2D2
Oh my gosh.
okay. It goes with my R2D2 keychain.
What does RTD2 have to do with OT and speech?
There you go. Well, if you think about it, he does not appear to have very good fine motor skills.
No. Or
But
body perception, body awareness.
yes. But when he needs to accomplish something, he does find a way to use his tools adaptively to make things work. So
yeah.
I think that he's awesome.
And
But here's something. Oh, I'm sorry.
go ahead. Nope, go ahead. Nope, go ahead.
That we're offering.
Now my mic fell. I'm falling apart here.
You are
falling apart. Okay.
I'm not quite sure how I'm saying that. I don't know how to say that right. Let me think for a minute. So I have 3 books. I don't like any of this, so I'm going to start all over again.
Go ahead.
Tink. A young kiddo, an 18-month-old or a 2-month-old or a 2-month-old, a 2-year-old to sit and do some of those oromotor exercises. Well, kind of what I was saying earlier, that I feel like so everybody's so busy nowadays. Oh, I'm sounding old again.
Back in my day,
we just sat around and knitted socks. We had plenty of time to play with our children. Totally lost my train of thought. Where did that go?
The stuff on the back of the book.
Yeah.
Okay. What did you say before that?
I confused myself. I have no idea. Squirrel.
Yep.
Oh, I remembered.
Yay! I didn't even help with that. That was all you.
So I don't know if I don't want to say normal.
What's normal?
I am so not normal.
Me neither.
I know that I am not normal.
I like the complicated. Yeah, we're all complicated.
Stuff. That's the fancy word for it.
Oh yes, it's very technical.
Isn't it? Woo, fancy schmancy. Hopefully, I'm working on putting something out there together. Putting something together that will be out there. Oof. Boy, my mouth is not working. I need a speech therapist.
Hello, mouth.
Oh, gosh. Hello, mouth.